So what happens is you might be on this journey and now all of a sudden you and your doctor may think that you have sarcoidosis. So there are really three things that we need to be able to make the diagnosis of sarcoidosis. The first thing that you need to have is more than one organ involved. If it's just one organ, then we call it sarcoid. So granulomas need to be seen under a microscope. So granulomas are sort of the preeminent thing that we talk about. The next thing is that we need to make sure that it's not caused by infection. So if you're considering the diagnosis of sarcoid, it could be because you have a plethora of symptoms. Any one of these symptoms are all together. So you could have cough, you can have shortness of breath, low-grade fevers, night sweats, extreme fatigue, malaise. You can have chronic sinus infections, you can have joint pains, skin rashes, lumps, bumps, sudden vision changes or eye pain. You can have chest pain, frequent headaches, fibromyalgia. So really it can be anything. And that's one of the reasons why it's so difficult to diagnose. We often say that sarcoid is confused for many other things, and sarcoid is a late diagnosis because we usually go through looking for other things first. And we actually in medicine call it the great mimicker. So it actually can look like any type of thing. And sometimes it can be confused for a mycobacterial or a fungal infection. So mycobacteria is the bacteria that makes tuberculosis, and fungal infections for those who might be living in the southwest area, coccidiomycosis, for example. And they can look very similar on CAT scans, and they can actually present with similar symptoms. Lung cancer. So I've had many patients come to me telling me that they've been diagnosed with stage 4 lung cancer because they somehow had spots on their CT scan, and that led to a whole bunch of other workup, and all of a sudden a PET scan, and they have disease everywhere and they think they have cancer. And so that can be an incredibly traumatic experience for people. And it can also be confused for lymphoma. So when we're approaching sarcoid, we want to be thinking about those things